Whoa, Kayla, you are up early.
Yeah.
Oh, goodness. Are you watching the race? Or
No.
you don't care about that stuff?
Well, I kind of looked at it last night, but
Yeah. I know it's interesting, isn't it?
yeah.
Alex, do you follow the race?
Not really, no.
No. Okay. You guys doing okay on Thursday?
Yeah.
Yeah. Hi, Caden. Good morning. Morning, Caroline. You guys believe we got 3 weeks until Thanksgiving break? That's crazy. But just so you know what's up and coming. Morning, everybody. How's everyone doing today? I'll wait till 37 like always just to get everybody up and awake. Hi, Kelsey. You guys will be turning your warm-ups in today, so once we're done with these, just turn them in. Just make sure you got your caps and ends and your complete sentences and all those important things done. Morning, Cameron. Morning, Connor. Is there anybody here that will go back to sleep after their day of school ends? Or will you guys be up for the rest of the day?
Up for the rest of the day.
Oh, okay, good job, Cameron.
I'll go out like a light as soon as my phone is out done.
Oh my goodness. That is pretty funny. Well, good. That's called good parents, Alex. Oh, goodness sakes. Alex, did you change your picture? Didn't you used to have
Yeah.
the doctor one? What'd you call that?
Plague Doctor.
Yeah. What is your picture now?
Me.
Oh, I can't really see you that well. It's so far. I mean, it's not a real close. I mean, it is a close up, but in the computer, you can't really see it very well. That's funny. Ian, have you watched a lot of Polar Express lately? Must be he's not fully awake or doesn't find Miss Ubka funny. Kelsey, have been into Kermit the Frog lately? No?
No, I haven't.
Didn't we talk about this before?
Yeah, it's just a frog picture. I don't know.
Does he like frogs?
Yeah.
Interesting. Very good. Well, Kermit's pretty funny. I'll give him that. All right. Enough shenanigans. Yeah, I know. I said shenanigans. I'm old. Let's just clear that up right now. Okay, so we're gonna go ahead and start our warm up. And remember, you can go ahead and turn that in when we're done. So let me get my screen up and you guys can see what it is you need to do. I didn't do a demo this week. I thought with the election and all that mumbo jumbo that I had to vote and do all that stuff on Tuesday, so I chose not to do a demo this week, but we'll be back at the demos next week. So just FYI, if you care. Okay, so your question today is, what does the word cardio mean? So if you're going to write a complete sentence, you would say something like, I think cardio means blah, 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 or the word cardio means, and then finish the sentence. With caps and ends, of course. Take a few minutes to look up at the old ones that we did and make sure that they also have their caps and ends, complete sentences. I was telling 5 or 6 people that were in here already, but we got 3 weeks until Thanksgiving break. That week of Thanksgiving break, I believe we have Thursday and Friday off because Thanksgiving is always on a Thursday. So I'll just tell you the date. So Thursday the 26th and Friday the 27th, there's no school. So just kind of FYI on that. And if you do see your teachers during office hours at times, Friday the 13th, there will be only a half-day schedule for office hours. So if you see your teacher, they have office hours later in the day on Friday the 13th, more than likely you'll have to reschedule those. So that's just kind of what's up and coming. I think I put about 30 kids on reach cards this week. So hopefully this Friday when they do their draw, your name will be picked. Let's cross our fingers. Hope that happens for you. You got about 30 seconds left. Try to finish up if you can. I'm going to go into the next thing I want to do, which is Quizlet. I always like to start class with the warm-up and then review anything that we've reviewed before or anything that we learned to kind of just keep it in the forefront, keep our minds focused on it. Usually why I go over these is because they're either, in a true or false, multiple choice question, and the more you hear it, the more you will remember it. And then you don't have to rely on your notes so much, and it becomes part of your thinking. So when I can, I always do a Quizlet. With any class you take, there's going to be vocabulary. And again, any of those vocabs can be turned into any type of a question. And you want to just make sure that you are practicing the words that you're going to have to know. So the first question would be, what is the term that goes with healthcare that focuses on the aspect of a patient physically, emotionally, and socially? What is that called? And I can't see your chat, so if you put something in the chat, I won't see it. So you got to unmic yourself. Does anyone know this answer? It starts with an H. I also shared this on Google Classroom. Anybody know? I know it's early, but it would be nice to have some participation here.
Holistic approach.
Thank you, whoever was brave enough to tell me that. Good job. All right. Death that occurs due to lifestyle behavior, it's fatal accidents, avoidable diseases. What would that be? Think about the timeline. There's 2 spectrums. What are they? What is this one?
Premature death.
Thank you. What is an overall state of well-being or total health? Starts with a W.
Wellness.
Excellent. The state of being comfortable with yourself, with others, and with your surroundings. Comfortable with yourself. What type of health?
Mental health.
Yep.
Isn't that mental health?
I can't, you just cut out like 3 times, so try again. I didn't catch that. All right, well, if you're brave enough to ask it again, I'm sorry, you cut out 3 times, so I couldn't really make out what you were trying to ask me. Okay, moving along. Fitness of the body, referring to how well your body functions. What type of health? Yes, thank you.
Physical.
What about another word for heart? We learned this the last time we were together. It's a new term. Has to do with things like running, basketball, swimming. Yes, nicely
Cardio?
done. Okay, what is the leading cause of death in the United States? I know you guys know this one. Yep.
Heart disease.
A state of wellness, which is your peak physical, mental, social well-being. It's that other side of the spectrum. You got premature death, and then you have what? Starts with an O. Yep.
Optimum.
Okay, what's another word for vessel? It's the other side of the part of the word for cardio. Nicely done.
Vascular.
Okay, influence people your own age. It's kind of a social thing where you influence your friends. What do we call that? Starts with the P. I know you know this one too.
Peer pressure.
Yippers. Okay, the process by which your body takes in and uses food.
Nutrition.
You got it. What is the doctor when he comes in? He's going to give you a what? It's the identification of a disease.
Diagnosis.
And a suggested answer to a scientific question. Has to be tested and verified. Starts with an H.
Hypothesis.
Yipper. The state of the physical world, that includes the condition of water, air, and food. What kind of quality is that?
Environment.
Yipper. Okay, and then how well you get along with others. What type of health?
Social.
You got it. The average length of a life of a person living. Life what? What is it called? Life what?
Expectancy.
Nicely done. Okay, a substance that provides nourishment. That would be your key there. What are the substances that provides nourishment? Starts with an N. Go ahead.
Nutrients.
Yep, thank you. The leading cause of death for your age group?
Accidents.
Yep. And the process researchers use to find answers to their questions? What is that process that they go through?
Scientific method.
You got it. And the last one, the principle that tries to explain something that happens in nature, starts with a T. What starts with a T?
Theory.
Yeah, nicely done. Okay, so those are really all the terms that we've talked about so far. I'll be adding some more as we progress through. So just know that we'll probably be doing this each time that we meet, just to recap and remind yourself, oh yeah, we do have some things that we did that we should probably work on. So it's just like going to a basketball practice or football practice. You practice a play to get better at it. So this is kind of like our practice. So when you take the test, you're actually so efficient at it. Okay, so we're gonna go back to, I call this the Carl packet because it's our case study, if you remember. And I can't remember, I know, do you guys remember the 4 types of cardiovascular diseases? Or do you know one of them? So they are atherosclerosis, hypertension, heart attack, and stroke. Okay, so I'm gonna talk about those, but I can't remember. Did we watch the video on atherosclerosis? Because I feel like this is exactly where we left off, right here. Can somebody verify that with me?
I don't even remember us starting this.
Okay, well, and then let's recap it back. All right, whoops. Okay, I think that's where I kind of started it, because didn't we talk about what we knew about a heart attack or stroke, right? And then I asked you what risk factors lead to a heart attack and stroke. Can you verify if you remember that on the Padlet?
Yeah, we did that.
Okay, thank you. All right, so then this is probably where we ended up. I'm gonna just, if we did this, just kind of bear with me, but about 1 million US teenagers do have high blood pressure, high blood sugar levels, or other conditions that put them at risk for heart disease later in life. This was our guy, this is gonna be our case study, and we're just gonna call him Carl. And he is a high school student in 9th grade. Lots of friends, favorite subject's biology, gets good grades. Doesn't play any organized sports though, but he does like to skateboard in the park about 2 to 3 times a week. So what I just want you to kind of be thinking about, not answering, but just be thinking about is, if you were going to evaluate this person and decide whether they're at risk for cardiovascular disease, what would you want to know about him? Okay, so just be thinking about to yourself, what would you want to know if you had to, run him through a test to see if he, is susceptible or at risk. So just kind of be processing that as we go through. So I thought that we did what cardiovascular was because you guys answered that, so I'm assuming we got this far. So remember that cardio means heart and vascular means vessel. And I am going to talk about the heart a little bit, a little in depth, not terribly so, but I think it's a pretty cool organ and it's really important. And because heart disease is our #1 killer, there's a lot of reasons for that. One of them we're going to probably get in real deep in the next couple weeks, and then even further on into the year. So I just wanted to do like a quick overcap of it, just so that you have some information about the heart. So what you need to know is that there are 4 specific types of cardiovascular disease. So it affects the heart and the vessels, and that's a heart attack, a stroke, a hypertensive or high blood pressure, consistently higher than normal blood pressure, and then atherosclerosis. Okay, so all of those are considered cardiovascular diseases. And like I said, they are dealing with your heart and your vessels. So the first one, and that we're going to talk about, and we'll hear about it as we talk about nutrition and things like that, is atherosclerosis. And that is a condition where there is plaque in the arteries that build up and can cause a blockage. And some of that could be possibly by what you choose to eat and can affect that. So if you are a healthy individual, then your blood flow looks like the very top artery. Your blood is flowing through. There's no obstruction. It's getting where it needs to go in a quick manner. The second one down has to do with plaque starting to build up and narrowing the passageway of blood. You can kind of look at that as an expressway where if there was a backup and I'm trying to get on the expressway, there's going to have to be a car that moves so that I can get in. So I'm still going to make my destination, but it's going to take me a lot longer to get there. So I might miss my meeting or my appointment or whatever. So it's kind of like that, where, you know, your blood is having to take a really long time to get to where it needs to go. And that can be an issue if it's trying to feed tissue that needs oxygen to survive. So it's kind of perpetuating a problem that's going to get worse. And then you look at the very bottom one, and that's actually where the plaque is kind of broken and white blood cells attach themselves to it and then cause a complete blockage. And that's where you are going to see in the next slide where a heart attack and a stroke come into play. So that just means that there's like this terrible accident on 94 and you're not going anywhere. Okay. And then it's going to back up, back up, back up, back up. And, you know, then terrible things can happen in the body if that occurs. Death is one of them. Okay. So I want to show you a little video on that. And it's going to talk about heart disease and also, not heart disease, I'm sorry. It'll talk about atherosclerosis and blood pressure at the same time. But remember, with the Google Meet, I have to get out of presentation mode and then do this other little piece to be able to get you guys to see what I'm going to have to show you. So hopefully I can get it to go. And I think it left. Yeah, okay, that's okay. So let me go grab it. Okay, here we go. And then Cameron, can you just make sure you can hear it and see it so I'm not, you know, wasting my time?
Yeah.
Thank you. And I'm going to shut my camera off because that usually causes a problem. Uh-oh. Hold on. Okay, there it is. All right, Cameron, can you see that?
No.
Okay, I'm trying to shut my camera off and do a billion other things at one time. Hold on. Shut camera off. There we go. Okay.
Power bank from Fort Patriot.
Oh, now I can see it.
Okay. There we go. It'll be a little glitchy at the start, but it'll clear up.
If
There
you
we go.
lined up all the blood vessels in your body, they'd be 95,000 kilometers long. And every day, they carry the equivalent of over 7,500 liters of blood, though that's actually the same 4 or 5 liters recycled over and over, delivering oxygen and precious nutrients like glucose and amino acids to the body's tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. The blood traverses the landscape of the body through the pipes of the circulatory system. In any plumbing system, several things can increase the force on the walls of the pipes: the properties of the fluid, extra fluid, or narrower pipes. So if the blood thickens, a higher pressure is needed to push it, so the heart will pump harder. A high salt diet will lead to a similar result. The salt promotes water retention, and the extra fluid increases the blood volume and blood pressure. And stress, like the fight or flight response, releases hormones like epinephrine and norepinephrine that constrict key vessels, increasing the resistance to flow and raising the pressure upstream. Blood vessels can usually handle these fluctuations easily. Elastic fibers embedded in their walls make them resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the already narrowed pipe. If the clot is big enough, it can completely block the flow of oxygen and nutrients to cells downstream. In vessels that feed the heart, that will cause a heart attack when oxygen-deprived cardiac muscle cells start to die. If the clot cuts off blood flow to the brain, it causes a stroke. Dangerously clogged blood vessels can be widened by a procedure called an angioplasty. There, doctors thread a wire through the vessel to the obstructed site, and then pass a deflated balloon catheter over the wire. When the balloon is inflated, it forces the passageway open again. Sometimes a rigid tube called a stent is placed in the vessel to help hold it open, letting the blood flow freely to replenish the oxygen-starved cells downstream. Staying flexible under pressure is a tough job for arteries. The fluid they pump is composed of substances that can get sticky and clog them. And your typical healthy heart beats about 70 times a minute, and at least 2.5 billion times during an average lifetime. That may sound like an insurmountable amount of pressure, but don't worry, your arteries are well suited for the challenge.
Okay. Cameron, can you still see my screen or not?
No, your like presentation's off.
Yeah, I know. It's a different mode, but I just was hoping that I didn't have to switch back.
Oh,
So I'm going to have to. That's okay. I got one more video that I have to do this rigmarole for, but I'll make it work. Okay, sorry. All right, so hypertension is a disorder in which a person's blood pressure is consistently higher than normal. Okay, and that can also be affected by what we choose to eat. Okay, so it's important to know. Usually, sometimes when you go to the dentist or doctor's office, you get kind of uptight because you don't like to do those things, and your blood pressure might rise because of that. So that would maybe alert the doctors that your blood pressure's up, but they would probably want a more lengthy form of information. So they might have you take your blood pressure a couple times each day for 2 weeks and then come back to the doctors and have them analyze your blood pressure. So it's not going to be, a one-time thing and they're going to put you on blood pressure medicine and be all concerned. But, if it's something that happens quite frequently, then you might be considered hypertensive. And, it doesn't have to necessarily be nutrition. It could be stress, anxiety, things like that. Okay, I'm going to skip that slide for just a second and go to blood pressure because that's kind of what we're talking about. But basically, blood pressure is the force that moving blood exerts against the walls of the arteries. And whenever you go to the doctor, you get your blood pressure taken. It doesn't matter. That's one of the first things that they're going to do once you get into the office is they're going to probably check your pulse. How many times does your heart beat in a minute? And then they're going to take your blood pressure as well. So the numbers are kind of important. So when you're doing the systolic pressure, that's going to be the pumping pressure in your arteries when your heart is pushing the blood through. So with each beat of your heart, that is the systolic pressure. It's when your heart is pumping that blood. Usually 120 is where you want to be. So basically when you do a blood pressure, you're going to use the cuff. The nurse is going to put the stethoscope really close to the edge of the blood pressure cuff and be detecting your brachial artery. And as they squeeze the cuff, the little, it looks like a little clock kind of, or a little gauge, if you will, They're going to pop that up to right around 160, and then they're going to start slowly depleting the cuff's pressure. And as soon as they hear your heartbeat for the very first time, that's going to be your systolic pressure. And you can, as like when when they do my blood pressure and they get it up that high, I don't feel my heart right away. And then all of a sudden I can feel the pulse of it. And that's when the nurse is looking at the sphygmomanometer, which is what it's called. And she's taking a reading, okay? Or nurse, can be either, but they're taking a reading, okay? And whatever that reading is the systolic pressure. And then what they're gonna do is they're gonna start hearing the heartbeat. You're gonna feel it. The pressure is gonna start to dissipate. And then when they hear your heartbeat for the very last time, that is gonna be the measurement of your diastolic pressure. And that would be right around 80, okay? I like to remember systolic and diastolic pressure because it's kind of like a math problem. So if you're really good at math, or you're familiar with a numerator and a denominator, so the systolic pressure is the numerator and the diastolic pressure is the denominator. And I always like to do a play on letters. So diastolic, denominator, they both start with D. So that should help you remember which one's on the bottom. Okay, so moving back to that one slide about a heart attack. A heart attack is also called a myocardial infarction. So when you are in a hospital setting, you're not going to have necessarily a doctor talking with another doctor saying that this person or patient had a heart attack. They're going to probably call it a myocardial infarction. Basically, that is when the blood vessels around the heart are blocked. A lot of people, don't really know exactly what happens during a heart attack. They might think that, one of the valves gets clogged or, something with the interior of the heart. But a heart attack has to do with the outside of the heart. And I don't know if you've ever seen a heart, but there's vessels that go around it that feed the heart muscle and keep it healthy and strong and oxygenated. And when a person has a heart attack, those coronary arteries, which is what they're called, they get blocked, and that's what causes a heart attack. And so if you look at my screen and you can see the heart, right at the very tip of the heart at the bottom, they're trying to show you that that's where an obstruction could be. And they're showing you in other spots as well. But if there's a disruption, that's what's going to cause a heart attack and someone to be in pain. And what they can do, and you'll see in the video, or you saw in the last one too, but they can put a stent in there to keep it open, or they can do what's called angioplasty, which is they put this metal rod that's really small and they inflate a balloon and it breaks up that bacteria or the plaque. Okay. But a heart attack has to do with the coronary arteries, and that's on the outside of the heart. So I'm going to try to play this one for you. And this is just talking a little bit about the heart specifically. Okay, let me switch out of this mode and go into a different mode, because it's so much fun. Yes. Okay. I think I can play it. All right, Cameron, you're my guy. Let me know.
Dear Mrs. Claus.
Dear
We
Mrs.
can do it.
Claus, for centuries, you've run.
Okay, here we go.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Okay, so hopefully that explains a little bit more in depth about a heart attack or stroke, and you don't have to listen to me all the time talk about it. Let me go back to the right screen here. Okay, and then a stroke, I'm not going to show you that little video clip because then I have to switch out of this again, and that's just a pain. So basically, a stroke is a blocked or ruptured artery in your brain, okay? And it can cause a lot of issues where someone could have paralysis, they may not be able to speak properly. There is an acronym, and I'm trying to remember everything about it. It's called FAST. And so if you think somebody's having a heart attack, or sorry, a stroke, you can remember FAST, okay? So F stands for face. So that means that, their one side of their face may be droopy, one side of their body may not be functioning like it normally is because it's affecting a part of your brain where that is being able to function by that part of your brain. A is arms. So your mobility is not good, so you can't like lift your arms up or something along those lines. S is speech. So if somebody, like you ask them a question like, are you okay? You know, can you tell me what's going on? They won't be able to communicate with you because part of their brain is being affected. And then T, I can't remember exactly. I think it means timing. Like you really need to get them to a medical facility quickly. You know, some people have mini strokes. Some people have an actual stroke. Strokes can kill. So that's why you really want to get a medical professional to diagnose or figure out what they can do to help. They don't have to have lifelong effects from their stroke. They might have no effect after they've had the stroke. They may have, you know, numbness on, you know, like let's say one side of their face, or they're not able to remember things as well, or they might have to go to like a speech therapist, somebody that helps them be able to communicate, because that was part of what was affected on the stroke. But if you ever get a brain scan, or what they call a CAT scan, they can see where you had the stroke. Okay, it kind of looks like a little pin on the brain scan, CT scan. I can't remember that. And you know, so they can kind of see where you had some tissue destruction. So they can determine that. But just try to remember fast if you think someone might be having a stroke, and go through those things with them and get them help immediately. All right, so I want to do a little bit with a heart diagram. Like I said, you know, it's a pretty extensive organ. It's, you know, beats constantly throughout our life. It is something that can be affected by what we choose to eat. So I just want to do a little bit with the heart diagram. So give me a second, because I need to basically, I have it here. I just need to give it to you guys because I haven't given it to you yet. And I want you to open it, and we're going to work on it together. Once you get it done, just turn it in, and then I'll give you points for doing that. And I might offer extra credit on the test if you fill out the heart diagram. So I might offer a new one. It will be a time thing, so you know that it doesn't give you time to like look things up or get out your notes or whatever. It should be an extra credit piece that you do just by what you know. So go ahead and open that up. I'm going to make a copy for myself so that I can go through it with you. And not print. What am I doing? Okay, so I'm going to make a copy. Hello. All right. So here we go. Now, there's a couple things about the heart, and, you know, chime in if you know stuff, because I know that one of the biology teachers does talk about the heart. So if you know some things as we go along, that would be helpful. But the best thing I can tell you is when you look at a heart diagram, always remember that your left is your right and your right is your left. Because when you look at a heart, they're showing you the opposite direction that it goes in your body. So you always want to switch the sides of the heart. And there are 4 identifiers in the heart that refer to right and left. So if you can figure out what side you're looking at, that's going to help you identify it really easily. So I always say, first time you ever get a heart diagram, always put the R and L on the opposite sides, and that'll keep you organized for what you need to do. All right, so does anyone know what number 7 is? What is number 7? Anybody? Okay, so number 7 is called the superior vena cava. And how I remember that is, you know, when somebody is superior to you, they're above you, okay? So that's how I remember this vessel, because it is above the heart. And so I remember that it's the superior vena cava. You're kind of on your own with that one, but that's how I remember superior. And then number 8, does anyone know what that one might be called? What would number 8 be called? Like, what makes sense? Use some common sense. If this top one was what?
Lower vena cava.
Okay, let me say this to you. If the top one was superior, what would the bottom one be? What's the opposite of superior?
Inferior vena cava.
Yep. Okay. Now, in the heart, there is 4 rooms. I like to call them rooms. And the top rooms are called the same, and the bottom rooms are called the same. Does anyone remember what this top room is called? Any piece of the title of that one for number 1? Any thoughts? Okay, well, what you need to remember is what side of the heart it's on, and that's the right side. And the top chambers are always called atriums. So, number 1 is the right atrium. And just like in your house, when there's a room, there's always a door. So letter A is actually a door. Do you know what that door is? Like, what is it? Not the name of it, but what is that? Do you know? What would letter A be if it's a door? No takers?
A valve.
Yes, good job. All right, so it does have a specific name, and I'm going to tell you right now it's called the tricuspid valve. And the reason it's called tri is because there's actually 3 cusps on it. So just like a tricycle has 3 wheels, if you can remember back when you had a tricycle, this has 3 cusps, so that's why it has the name tricuspid. And then, do you know what number 2? This is a room that we've entered into. Do you have any idea what number 2 would be called? Number 1 is the right atrium. Do you have any idea what number 2 would be called? Any idea? Well, it would be called the right ventricle. Okay, because the bottom chambers are ventricles. And if you look at the picture, this kind of looks like a V to me. So I always remember that it's a ventricle just because this reminds me of the letter V. Okay, so if that helps you. And then what's cool about these next few vessels is that the vessel after the door, so this is another door. So the vessel after the door gives that door its name. So can you tell me again what the door is? What is letter B? What's the door? What is it? Someone told me what letter A was. What's B? Just what is it? Any takers? Logan?
It's a valve.
Okay, thank you. All right, so it does have a specific name, and it's called the pulmonary valve. Okay, the reason it's a pulmonary valve is because it's going to go up into the pulmonary vessel right here. So this door gets its name from the vessel right after it, okay? So that's kind of how you can remember that one. Something else I was going to tell you and I forgot now. Okay, so the next vessel is a pulmonary. Oh, I know what I was going to ask you. What vessels take blood away? Do you guys know? What vessel in your body takes blood away from your heart? Any takers? Do you know what the 3 blood vessels in your body are? Let's start there. What are the 3 blood vessels in your body? What are they called? Anybody know? Anybody know one of them? Like one.
Is artery?
Veins one?
Yes, so veins and arteries. And what's the third one? It's the smallest one. I'll give you a hint. It starts with the letter C.
Is it like capillary or something?
Yes, capillaries. Okay, so let me give you a little information. Arteries are the largest vessel in your body. They carry the largest amount of blood, and they're very deep in your body because you wouldn't want them to be on the surface and then, get a cut or something and bleed to death. So they're deep into our bodies. And arteries carry oxygenated blood because if it's going from the heart away from our body, then it's basically feeding our tissue, so it's going to have oxygen in it, okay? Veins, on the other hand, carry non-oxygenated blood because they're bringing blood to the heart, and they're superficial, which means you can see them, and they are on the surface. But if you severed one, you wouldn't bleed to death. I mean, blood's going to come out, but not at the rate as if you were to cut an artery, because that's carrying a larger portion of the blood. So if I told you that this pulmonary vessel is taking blood away from the heart, what vessel is it? Out of the three options, which one is it?
A vein.
Nope. Veins bring blood to the heart, so arteries take blood away. And if you look at the picture, blood is going away from the heart. It's coming out here and going away. Okay? The best thing I can tell you to remember that is that the word away starts with A, and so does the word artery. Okay, so that's how you remember that this is an artery, is because it's taking blood away. And another thing you can remember too is pulmonary is another word for lungs. So when the blood is going out the pulmonary artery, it's actually going down to the lungs to get oxygenated, and then it's going to come back. So if it goes out the pulmonary artery, what is going to bring blood back? Like, what makes sense? If this one's a pulmonary artery and it's going to come back through what? What makes sense there? Use some common sense if you got some. If
Pulmonary vein.
Yes, nice job. Pulmonary vein. Okay, now there's an exception to this rule, because remember, I told you that arteries carry oxygenated blood and veins carry non-oxygenated. But this is the one exception to that rule in your body. Okay, so listen to this. This is an artery, yes. Okay, but in this case, it is carrying non-oxygenated blood. It's going to take it to the lungs to get oxygenated, and then it's going to bring blood back to the heart in a vein that's carrying oxygen. Okay, so this is the one exception to the rule about arteries carrying oxygenated blood and veins carrying non-oxygenated. This is the exception. Okay, so sometimes that throws people because they're like, oh my gosh, but what you have to remember is the away and to. So arteries take blood away and veins bring blood back, because that is true in this case. But in the case of what kind of blood is being carried, it's the opposite. Okay, and this is that one exception. Okay, so what about number 3? It's a room. Do you remember what those top rooms are called? What is the top room? Do you remember? Look back at number 1. What is that top room called?
Left atrium.
Nicely done. Left atrium. Okay. And then we're going to go through another doorway. So we know the door is called what, but what specifically, you may not know its name, but what is it? Let's start there. What is the door? Logan?
I have a question.
Oh, yeah, go ahead.
So we're having a quiz today. That's what you said?
Oh, no.
What's the test?
The test probably won't be, oh boy. At the earliest, probably Monday of the following week. So not next week, but the following. Does that make sense?
Okay, because my computer keeps kicking me out of your class. Yeah,
Okay,
my computer
so-
keeps kicking me out of class. I had to ask that question.
Okay, I'm glad that you asked it. Remember, though, if your computer glitches or something, remember I'm always recording. So I'm putting the videos right on the live stream in Google Classroom. So you can always go back to this little section and find this and, get the information if you glitched in and glitched out. Okay, that's not a problem. All right, so tell me again, Logan, specifically. Anyone else can tell me too, but Logan's been answering my questions. So what is this door called? Can you give me that? Logan? Hello?
It's the try thing,
Yeah,
right?
but what's its name? Like besides that.
Valve.
Yes, thank you. That's what I wanted you to tell me. Okay, but this one is called bicuspid valve, and why is it called bi? You know? Anybody? Because bicycles have two wheels and bi means two. So if it's a bicuspid valve, that means there's two cusps. Something else that I would like you to know is that it's also referred to as the mitral valve. So either one is fine, but it is referred to sometimes as the mitral valve. I think I forgot an R in there. There we go. All right. Now, number 4 is a lower chamber. So if you look back at number 2, what would number 4 be called? Anybody can tell me. Alex, Logan, Ian, Caroline, Amelia, anybody. What would this bottom room? Yes, thank you. Okay, and then another door. What's this other door called? What's my door? Logan, what's the door?
Valve.
Okay, anybody know what this valve is called though? Any thoughts? Okay, I'll just tell you right now that the vessel after it gives it its name. So do you know the largest blood vessel in the heart or in the body?
Artery.
Nope. It does start with an A though, I'll give you that. So this letter C is going to get its name from the vessel right after it, and it's called the aortic valve. Okay? And so the vessel right after it is the largest artery in the body, and that's called the aorta. So if you look up here, it's a pretty big trunk line. This first little part right here goes to your head. These two go to your arms, and then it comes down. If you can kind of see it behind here, it'll come down and go to your legs. So if this somehow got severed, you would die very quickly because it carries a large amount of blood because it's the largest vessel. It's also very thick. So if I had to reference it to something that you may know, have you ever seen those really thick rubber bands? That's kind of what an artery kind of looks like. It's really, really thick like that. So the last identifier right here is this part that divides the heart in half. Does anyone know what this is called? It's the same thing that is in your nose. It's the same term that is referred to as anybody? Okay, it's the septum. And that just divides the heart into right and left sides. So this is just an FYI. And I might ask it as an extra credit thing, maybe. So just so you know, the outer layer of the heart, and I'll explain how I remember this, but the outer layer of the heart, and I'll write it down here for anybody that wants it, just in case I ask it as an extra credit question. I'll just write it in here. So the first layer of the heart, maybe it's not going to let me go down here. Get down here. Oh, hold on one second. I'm trying to figure out why I can't type. I'll just type here. So the first layer of the heart is called the myocardium. And it kind of looks like saran wrap. If you ever looked at a heart, it looks like saran wrap. And then the second layer, and I remember, I screwed that up. I'm sorry. I'm getting ahead of myself. It's the pericardium. Hopefully you can just erase it like I did. Okay, so sorry, pericardium. Some people look at that as like the word perimeter. So P and P, perimeter, pericardium, outer layer of the heart. Second layer of the heart is called the there it is, myocardium. And I look at that as the middle. Okay, so it's the middle layer, it's the septum, if you want to look at it that way. And then the third layer of the heart is called the endocardium. And I like to use the word enter for that. So I like to, reference things that are easy for me. So pericardium, perimeter, outside. Myocardium, middle, septum. Endocardium is the very inner part of the heart. And I just remember that by saying the word enter. There's also little tendons that open and close the valves called chordinae tendines. And they're very strong. They're like a tendon. And the pericardium is very strong. But when we think about the myocardium and endocardium, it's kind of like if you ever looked at raw meat, like a steak, that's kind of what it looks like and how strong it would be. So it's, not super strong. Okay, so there is the heart. I have talked long enough and it's time for me to go. So turn that in and I will collect it, get you some more points on the Power School, and have a great day and turn your warm-up in. Don't forget. Sorry, I was a little long-winded, but I ended right on time. So take care. Hope you learned something today, and we'll see you next week, Monday.